have some injuries. You have some level. So there's no uh, there there there's no way that you cannot have an injury. So, matter of fact, I'm editing a textbook for human kinetics publishers right now on dance injuries. And the premise of that, in that, one of the main premises in that book is you don't prevent injury, you simply reduce the risk of
Yes.
having one. So there are things that we can do to reduce the risk because you know that there's going to be injury. That's the
Yeah.
way the world works. So I think
Yeah.
there's a lot of
So,
lot.
and for that's kind of a new shift in language too, right? Like I feel like we used to use the term even 2 years ago, injury prevention, injury prevention. It's all about injury prevention. And now I feel like the language is shifting more towards injury risk management and mitigating and focus on mitigating injuries instead of completely stopping them. Because I don't think that that's possible. It's like the idea of perfection, like you're never going to achieve perfection, right? So progress is what we look for. Um, is that so? That's the new thing. Like the new term is injury risk management. Would you say
Yeah, yes, risk management or risk reduction. Yeah, just trying
risk
to.
reduction?
So there's so many different variables that can come into play. Some are intrinsic to the dancer, some are extrinsic to the dancer. They're environmental and all different kinds of things. There's lots of different things that come into play. And so what you do is you just survey those and you control as many of them as you possibly can,
Yeah.
knowing that you probably can't control everything all the time. And so then you have to be ready to do the right thing when an injury
Uh-huh.
does occur.
Which that's a totally different episode, I think, when it comes to
Yeah, yeah,
what
right.
we do
Yeah,
when there are injuries and what are we supposed to do versus what we actually do. And hopefully we see an improvement there too, but we'll talk about that another time. So when a dancer or a parent of a dancer goes to a practitioner or a specialist for injury care or prevention, really, or not reduction, let's say, rehab, anything of that nature, what questions should they be asking or what credentials should they be looking for to determine if this person is qualified and has the knowledge necessary to really treat their dancer and and is knowledgeable in dance medicine and science? A lot of people don't know what those questions are that they should be asking. A lot of parents have no idea what they should be looking for as far as qualifications. So what should tell everybody out there and studio owners too who may be referring dancers to specialists or doctors, what are we looking for?
well, most likely the typical person that you would go to would be a physician, right? So you want somebody who is skilled in the diagnosis and care of injuries. And so typically, a primary care physician who has a sports medicine fellowship would be a good credential to have, a sports medicine fellowship. Orthopedic surgeons can also have sports medicine fellowships. Usually those are sports medicine and knee fellowships that combine. Um, Sometimes they'll have shoulder fellowships. Sometimes they'll have hand fellowships. Right. So there's all these different specialties of being a physician. But in primary care, what you're going to want to look at. So primary care is sort of your family physician, right? Your primary care physician.
Yeah.
The typical person that you would go to for all of your different things that you needed. So
Right.
many of them will have a sports medicine fellowship, and that means they have additional training in sports medicine, which is the closest that you're going to get. There are no fellowships in dance medicine, so you
Yeah.
find something that is as closely related as possible. And so that would be one thing to look for is, does this person have some added qualifications in sports medicine?
And as far
And
as getting them to understand the needs of a dancer, what language should we be using to get them to really understand? Because I have to believe sometimes it's got to be a communication thing that the parents or the educators are assuming, maybe these doctors know because they're a doctor, right? But maybe they just need to be told in a way that resonates and they get, okay, this is what's happening here. So what is that language?
so the likelihood that a physician is going to have been a dancer,
Right.
not good, right? Now, I have a number of wonderful colleagues who are physicians who are also dancers, right?
Right.
But they're not all over the country. They're in specific metropolitan areas, right? And so that's gold when you can find someone like that, but that's probably not what you're going to find. I tell the dancers that as dancer patients, they have to be educated. They've got to be able to explain to the physician what the problem is. And now that presumes that the physician is going to close their mouth long enough to listen, right?
Right.
Which is another issue entirely because it comes down to communication. You're right about that. I also tell patients to bring a list of questions that you want to ask. Okay, bring a list of questions that you want to ask. Now, sometimes dancers just figure that these doctors have all day long, they can just kind of sit around and have a chat. And that's just not true. That's not the way the medical world works. And so I spent a lot of time trying to explain to dancers how real life works in a medical clinic. I mean, they're very busy. They're going from room to room. They have people running every aspect of their life in the clinic and out. And they're trying to do the best they can with some very tight constraints. So bring some questions with you,
Yeah.
but don't go through every single possible pain that you have. Like, focus, right? You've got to stay focused and respect their time. And if you
Okay.
respect their time, then they're more likely to respect you. And then, as far as I mentioned bedside manner before, bedside manner is a two-way street. And just because a clinician does not have good bedside manner does not give the dancer the right to have terrible bedside manner, right? Because
Yeah.
people by that bed, right? The old school thinking of doctor next to the bed, right? That's where that term came from, right? But
Yeah.
you're in the room, right? You're in the room and you're having this conversation. Well, the two-way conversation, and just because one person is not doing the right thing doesn't mean the other person should. You always be gracious, always be respectful, and ask questions and try to explain as well what it is that you do. Why is dance so difficult? What is so challenging? And put it in terms that they hopefully can understand. And then another thing, especially for parents to keep an eye out for. So we all are familiar. You go into a doctor's office, optometrist, dentist, whatever professional's office you go into, and there's all kinds of certificates and plaques and all sorts
Yes.
of stuff on the wall, right? And it's very impressive,
Hmm.
and it looks like, oh wow, this person's like amazing, right? And that's what it's supposed to look like. Well, let me tell you something. What's on their wall should never be more important than who's in their room.
Yeah. Okay.
And parents, particularly when we're dealing with minors and the parents are taking the children to these doctors, you can find out right away if the person in that room, if that patient is more important than all the stuff that's on the wall. And that's going to give you a clue. It may come down to you've got to go to 2 or 3 different places until you find somebody. If you know nothing about any of these people, you may have to go 2 or 3 places to find somebody where you say, this is this is somebody who's going to listen, who's going to help us. It can be frustrating. I have been through this with parents. I have been through this with dancers. I've been through this with all sorts of different artists. It is one of the most frustrating things there is because they want somebody to listen to them and take care of them. That's all they want.
Yeah.
And it seems like it's not a big deal, like it should be straightforward. Why is it so complicated? But it ends up being complicated, unfortunately.
Yeah. So I'm hearing you. I mean, I really feel like I'm hearing you say the patients and the parents really have to advocate for themselves. You can't expect that just because this person is a physician or medical professional that they're going to understand your pain point the same way that you understand your pain point. And so you really need to go in organized and do your part and be well researched, well educated, very communicative verbally about what is going on with you so that they can put that into terms in their mind that they understand, that they're familiar with, right?
That's exactly right.
That's
Absolutely.
great. Yeah,
Well
thank
said.
you. For those just joining, and I see people popping on and off on Instagram and Facebook. My name is Bree with Apollo. I'm the co-founder and CEO of Apollo Performance Wear. This is Beyond the Steps. We're missing my friend Melissa McDaniel today. She is judging. But I do have back with us today Dr. Jeff Russell, who is just a guru of dance medicine and science. And he has graciously agreed to come and chat with us today about what is trending in dance medicine and science in 2022 and what should we as educators be prioritizing happening regarding the health of our dancers. So, Dr. Russell, the pandemic has really forced us to train a little bit differently over the course of the last 2 years. There's been a lot of Zoom, a lot of, dancing in our living room on floors that are really not so great for us, right? What are one or two of the most common prolific injuries that you've seen most in the last 2 years or so that are different from what you would have seen before, or does that exist?
Well, so are you thinking of something like the dancer who got a concussion because she did a leap in her living room and hit the ceiling fan?
Or like leapt through the wall? Yeah. Yeah, stuff like that. Are we seeing a lot of things of that nature?
That's you see that from time to time. It's
Yeah.
more, you don't want anybody to get hurt, but that sort of thing is more comical than it is terrible, right? I mean, I don't know of anybody that's gotten drastically hurt doing
Right.
something like that, right? Well, I think the biggest problem is not that we're seeing something different or something new. What we're seeing is when you come back to dance and you try to get back into a more regular schedule,
Yeah.
you're in a detrained state. And
Yes.
so, the intensity, you figure, oh, it's just going to be the way it's always been. Well, it's
Yeah.
not going to be the way it's always been because it hasn't been the way it's been for the last year to 2 years. And so, you know, it's a little bit better now that we're back more. But when we were like everybody was out and we were trying to do things, in our living room, in our kitchen, or we were taking class online, the intensity isn't there. You just were
Yeah.
not able to do it. And so your body responds to that. Your body detrains. And so what has to happen when you're ready to go back to something that's more normal, if you will, you've got to be you've got to be ramping up. You can't just go, oh yeah, all of a sudden, woo, here we go, right? You've got to ramp up slowly to the level of where you need to be because your body is not used to the
Mhm.
intensity that you're wanting to put on it. Just not used to it, yeah,
Right.
because you haven't been doing that for a while. So I think that we had a lot of overuse injuries because we were coming back and trying to do too much too soon. That was the biggest thing that we saw. So dancers really need to be on their own recognizance to go through. I mean, they know what to do. They know what class is like. And so if
Yeah.
they can't do it in person with their regular teacher, they're going to have to do their own class on their own,
Yeah.
training their bodies so that when they do go back to their customary work, that they're at a proper level. So
I feel
dancers
like it's a
have to take
twofold problem.
responsibility.
Like it's the dancers having that expectation for themselves and managing that expectation of like, I want my body to be back in this place that it was pre-pandemic, but also you really, as a dancer, you don't want to let down your team. And like, if you're talking about a competitive dancer or a professional dancer, my livelihood, I don't want to let down my team. I want to still, this is what it takes to compete at this level. So I feel like we're also talking about, educators managing the expectations. Like if you're an educator, should we be expecting that our kids are going to come back and be able to still do 4 competitions and 5 conventions a season and still take, 6 nights of dance per week and do, 12 routines? Like, is that realistic, or should we be dialing that back a little bit?
Yeah, no, you're absolutely right. It is incumbent on the teachers, the instructors, the choreographers. It's incumbent on them to recognize this level that the dancers are coming back in, that they're not going to be completely in shape, and to build in that strengthening, that
Yeah,
endurance, the
I
physical
love that.
training aspect. If you don't do the physical training along with the technical training is going to break down. And so you've really got to play a strong role in making sure that the dance, because there's only so much you can do. I mean, I said that the dancers need to take it on themselves and do some things at
Yeah.
home on their own, but there's only so much of that you can do. And dance is very social in that we're used to being in a studio with others, right? We're used to be around other people, and when we're
Yeah.
with other people, it pushes us, right? We do better because we're around others. And so the teachers need to create that environment and allow those students to then come forward gradually and get back to that place where they want them to be. And it's the same thing. You just can't go straight up and expect to be at the same level. It's got to
Yeah.
be a slow progression.
I love that you said, and I want to repeat this for people that are listening or watching the playback very clearly. He said, build in cross training and strength training into your curriculum so that the dancers have that training at your studio. Because again, once these kids are back in school and they have social pressures and homework, and they're expected to be at studio 5 or 6 days a week training and taking class, there's only so much they can do at that time. So when you have built-in classes designed to get them back to that space and help their bodies, climb back to that space, I think we're doing everybody a service that way, including our own program. But if you're just expecting them to do that on their own, it's just virtually impossible for them to meet that expectation. So make sure that's going to require us as educators. We always talk about this, to get off the hamster wheel and re-examine what classes might look like this year. It might just be this year we have to rearrange, maybe take out a ballet class and put in a cross training class or a strength and conditioning class, right? So, really asking the educators to be cognizant of that and make those changes so that we're not setting our students up for failure. Because I ultimately think that that's what we're doing, right?
Right.
Casey, going back to your comment about when we were talking about advocating with physicians and things of that nature, Casey just shared something. It is so hard to balance as a parent advocating while pushing back on the docs when your gut as a parent tells you something isn't right. I just went through that with Gus, her youngest, and it's so true. It's the hard. You want to trust these. You want help, like you really just want help, like you said earlier, and you want this doctor to have the answer so bad, but yet your gut is just screaming. What they're saying to you. Your child as a parent, especially as a mother, and sometimes your gut's just screaming like this doesn't make sense to me. So what do you say to parents? In that situation, they've researched the physician, they've seen the credentials, they have that sports medicine background, the gut's still screaming. What do you say in that scenario?
Yeah, that's a really challenging scenario. But ultimately, you cannot give up your right as a parent. You cannot give up your parenting in favor of all these certificates and all sorts of things on the wall, and all the jazz stuff, right? Um,
Yeah.
we I used to live in Texas, right? And so when in
Same.
Texas we say if mama ain't happy, ain't nobody happy, right? And
It's
so
so true. It
uh,
is so true.
that is so true. That is so true. And so I think that you have to trust that, and you have to resist being disrespectful or showing frustration. Try to get whatever pearl or gem, whatever pieces of information you can out of that person. But it may be that you have to go for a second opinion.
That's what I was going to say. Is
You
that
know,
is that
and,
what you
and
recommend in that case?
yeah, because if you're not comfortable with the caregiver, then that's gonna have a negative effect on the dancer, right, on the child, on your
Yeah,
on your youngster, right? So if you, youngsters are super smart, as you
they
know,
sure
and they can
are.
figure it out. And if they know that you've got some reservations, but you're still going forward, that's that's just not going to be a good situation. And so, in my view, you've got to um, you've got to back up and maybe go for a second opinion. Now, I would make it to be a very informed second opinion, though, right? You've got to start connecting with other parents. In here in our town, there's a Facebook page for all the mamas in town,
Yeah,
right? So they all,
yeah,
so whether you're looking for a plumber or you're looking for a doctor or you need somebody to take your branches away that you cut off the tree, whatever it is, right? They're on this Facebook page, and so use something like that. Use the connections that you have to find out, okay, so this one's not right. Who do you know? Have you taken
yeah,
your daughter or your son to a doctor that's that's pretty helpful? And I would almost at that point say, you're better off going to a doctor with the right bedside manner who cares about people and is going to take good care of your child, but doesn't have the sports medicine background or the dance medicine background or anything
Yeah.
else, right? I would give
Really?
that
Okay.
up in favor of somebody that actually wants to do well, because what they'll do is they will go find out. If they're good at what they do as a healthcare provider and they don't know necessarily about dance and dance medicine, they'll go and learn. They'll find out if they're worth their salt. So I
Yeah.
think you just have to pull out all the stops and find that person. Just use contacts that you have and find that person.
Well, and I want to challenge educators too. And we've said this before on the show. It's something that I wish I would have done more as a director. I think we have a really unique opportunity as a director. We're expected to wear many hats, right? We have to be a counselor, a friend, sometimes a physician, and we're not qualified for any of those things, right? Nor should we be, because that's not the business we're in. But yet we become this thing to so many people. I think it would be really helpful for dance educators to have a list of specialists, psychological, medical, places for people to go, if they need dance wear. It's just as important as dance wear. So if you're going to send your kids to go here to get their shoes and everything else and your costumes, know who they should be going to if you get an injury, if they're struggling with mental health issues. Who are those people, so you can make that connection and bridge that gap, and maybe your parents won't feel so frustrated when these things come up. They won't feel
Well,
like a dark closet.
exactly, and that's something that the studios can do, right? They can be assembling, right? When they find out from a parent, hey, this doctor was really good, or this counselor was really good, or this, right? They can keep they can keep a running list of who those people are that the parents have had good experiences with. There's also an organization. I've got a good friend that runs the organization Doctors for Dancers, and you're probably aware of them.
Yeah.
But
Yes.
that's a nationwide network of healthcare professionals
Absolutely.
who know about dance medicine. They've been vetted, right? So they have a certain level of qualification. They've been checked out. Like, these guys are ones that we would recommend. And so that may not be for every possible locality in the country, but they're nationwide. They do have a lot of people that are resources
Yeah,
in their
thank you so
system.
much. If you're just joining, hello to everybody on Instagram and Facebook. I'm Bree with Apala. I'm chatting today with our very special, one of our favorite guests ever, Dr. Jeff Russell. This is a third time back with us. We're talking today about what's trending in dance medicine and science in 2022, and what should dance educators be prioritizing when it comes to making sure their dancers are supported and are able to return to the studio if they're recovering from COVID, from the pandemic in general. It's just been a really crazy time. So what are those priorities? So Dr. Russell, you're always ahead of the curve in dance medicine and science. You were treating dancers, early on when treating dancers wasn't a thing yet, right? So can you talk a little bit about any new protocols or methodologies or thought processes that we should be excited about or looking forward into 2022? You've already mentioned cross training and strength training. Is there anything else that you want to highlight?
Well, we just know a lot more. I mean,
Yeah.
we've had so much more research, and so we're smarter at what we do. We have improved understanding. We know that simply dancing is not adequate for the needs of the body, right? You've got to do some other things. I think one of the big things that has come along probably within the last 10 years at the most, that is the most, or one of the most hopeful, is the whole issue of food as medicine, the whole nutritional aspect. So a colleague of mine, Dr. Mark Hyman from up in the Cleveland Clinic, this is kind of his big thing. He'll tell you that the best medicine you'll ever take is at the end of your fork and not at the bottom of the pill box. And I think that we need to do a better job of figuring out that part of it, that part of performing and making the body to, work as well as possible, because it's being fueled as well as possible. I think that's a huge thing. And then another area is the whole aspect of whole person wellness.
Oh, sorry, my dog's barking. Sorry.
Yeah, no
It's
problem.
live.
That's the joy of Zoom programming, right? Get dogs and cats and
Everybody wake
all
up.
kinds of stuff. uh, but the whole person wellness, where the model that I use is a six-dimensional model of wellness that was designed by Dr. Bill Hetler back in the 70s. But it talks about the difference. So it's not just physical, right? So if you have a sprained ankle or some other physical ailment, well, that affects your emotions and it affects your intellect and it affects the spiritual aspect of you. It affects the social aspect of you, right? So there's this multi-dimensional, this six-dimensional model of whole person wellness, and I think understanding that, particularly in the pandemic, right, as we're you know we're still hanging on to this thing. It's just not going away anytime soon. It doesn't seem like there's just this new wave comes, a new wave comes. So the whole emotional aspect of that, the psychological, the mental health
The mental
component
health.
of that, you have to recognize that that's affecting every other part of a person's being. And so understanding that as humans, we're designed to be that way. We're not compartmentalized. We're this intricate, integrated, interwoven network of all these different dimensions that operate together. And so when I care for somebody as a clinician, or whether I'm teaching somebody as a student, or when I'm interacting with anybody, I'm thinking a whole person, because I've got to remember that they are not just a physical person, but they have all of these other components. So I think that's
Yeah.
been another big development that still needs more development.
Yeah. And there it's encouraging because there's been so much progress. We have, Ashley Mowry, who is, doing mindset skills for dancer. We now have Dan Send with Kristen Dice and Michelle Lucadou that's focused on mental health for dancers. We have, Leah Bueno's doing great things with rehabbing dancers from injury. And like you mentioned, Doctors for Dancers. And there's just all kinds of things. There's Bridge Dance Project now, which is, leading the way and educate dance medicine and science education for dancers. It's just we have so many resources now that we didn't have even pre-pandemic, that I feel like. And Kristen Koskinen, she's doing amazing things with nutrition. So all these things that you're talking about, it makes me feel good because I feel like it reinforces the things. Hi, oh, Leah's on. Hi, Leah. Yes, we love the Pilates dancer, Leah Bueno. Go check her out. She's awesome. But it just reinforces all the things that we've been learning through this show too, is like it's not it's a more than a one prong approach. Like it's not just one thing anymore. And if you're not flexing and exercising these muscles in all these other areas like mental health and nutrition and strength and conditioning and cross training, then you're not getting it right. You're not maximizing the opportunity as an athlete. So we're gonna put some resources at the end of this conversation here, but I want to highlight before we go on to the last segment, because it's kind of meaty one. What any tools or resources for injury risk reduction or recovery that you want to highlight and spotlight, besides the obvious, of course?
Yeah. Yeah. Well, I mean, again, thinking about the nutritional aspects, right? So the whole idea of recovery nutrition. So
Yeah,
we had this conversation 10 years or so ago. We wouldn't have understood about low fat chocolate milk as a recovery drink. Another one that's really superb, tart cherry juice.
really.
Cherry juice has been shown to have very positive effects, of anti-inflammatory effects, and a number of positive effects in recovery. Right. Particularly, I'm thinking about you have these students who are in competitions, and it's like the whole weekend long, and there's like competition after competition, right? Performance after performance after performance, and they're having classes and workshops, and so think about some of the recovery nutrition, and really, again, food as medicine. Um, and I think too that there's not so much new. I think we have to revisit things that are important that maybe got lost in the shuffle, because we're in this information age where the world's at the end of our thumbs, and there's just so much information. I mean, information doubles so quickly now, and there's so much of it, and you know
We're
who
overwhelmed
knows who,
almost.
who knows if it's good or not. You have to be
Yeah.
very discerning about it. And so I think revisiting some of the basic things and going back to things that we may have forgotten or that kind of got lost in all of the glitz and the big waves of information that have been flowing through our minds for the past
Yeah,
year.
Dr. Russell, I'm getting notes that we lost you on Instagram. Can you see me? Is your
Yeah, I
camera
can
pointed
still
at
see
you?
you.
Oh, there you are. We just lost your picture. There you are. You're back.
We're
Um,
good?
yes, thank you. But I feel you. Like there's been so much information presented that it's almost like we're inundated and we need to go back and examine to make sure we're processing it all correctly and applying it all, right? Because I feel like
Right.
maybe we got some information and it's like in one ear and out the other because it's just too much. We can only implement a few things at a time, right?
Yeah, we're not very good multitaskers as
No,
much as we want to be.
no. No. Casey did. This is a really great time to bring in Casey's second question. Should parents have their young dancers do anything outside of dance as far as getting them extra training or weight training if the studio is not providing those things, right? Because sometimes the studio programs just don't do it, don't do what the dancers need, and you have a choice as a parent to either leave or stay. And it's not an easy choice sometimes. So if you stay and that studio is not providing the curriculum that your dancer needs to be well-rounded, right? Should parents be getting that on their own? Or could that lead to overtraining? If they're doing the strength training on the side on their own, and then they're still expected to be at the studio 5 or 6 days a week, then are we contributing to the problem of overtraining, even if it's not necessarily
Yeah,
in the right way? Does that make
yeah,
sense?
this is yeah, that makes very good sense. This is really interesting. So a couple of different ways to approach it. So first of all, I think that they need to do some things other than dance.
I agree. Yes.
There's a lot of research in sports, not as much in dance, but there's a lot of research in sports that single sport specialization is not good on a variety of levels. And when you go back to that whole personal wellness that I was talking about, you've got some definite detriment to some of the other non-physical components of your wellness you are if you're creating an environment where dance is it, right? That's all you're doing. It's just like baseball. If baseball's all you're doing, then that's not a good thing. So I think there needs to be some things other than dance. In terms of weights, weights for youngsters, certainly lighter weights. They don't need to be doing heavy weight training. But there are a lot of guidelines. Like, the CDC's got some good guidelines for, you know, healthy exercise for children, healthy exercise for older adults, healthy exercise for adults that are in their 30s and 40s and 50s, and so I think going to the reputable places like that to
Yeah.
find ideas for what can be done, because it's hard to say, well, do this, because everybody's different, and
Yeah.
I think that you have to customize it a little bit, but it's also got to be something that you enjoy. And that's why I say do some things other than dance. Find some other things that you enjoy just to refresh your mind and to use
Yes.
your body at something else.
Yeah. Thank you so much, Dr. Russell. We're chatting with Dr. Russell today. Um, we're chatting with Dr. Russell today about what is trending in dance medicine and science in 2022, and where we as educators should be prioritizing our attention and our time for our students to make sure that they're in a happy, healthy, safe environment. And Dr. Russell, can you still see me on Instagram? Are you okay?
Sure can.
Okay,
I
good.
see
Good deal.
you,
Yep, yep.
and
I think
so
we
we're
just
good.
had a fade out for a second there. But this is a great time to remind you, we just talked about the element of recovery. Apollo socks. It's a fantastic tool to have in your dance bag, or if you're an athlete of any kind. We have 6 styles, all certified and accepted by the American Podiatric Medical Association to promote good foot health. And we have 3 independent studies that show that our socks reduce the force of impact on the body. Dr. Russell conducted one of those for us,
Sure
which
did.
we're so proud of and excited about. So yeah, I think, check them out. We have options for everybody, and we're going to be going live. We're live all this week talking, Casey and I, about our products. So drop in tonight. We're going to be live on Facebook, Instagram, and TikTok. And we're going through all of our products and features. Join us at 7 p.m. Eastern tonight, and we'll answer any questions. No question is off limits. So Apollo socks are fantastic for recovery as well as on the dance floor. So we hope you check those out. The last question is kind kind of a heavy one, Dr. Russell. So we want to help athletes of all types, but specifically dance athletes to stay healthy, right? So outlined what the top 3 priorities that dancers and dance educators should have for keeping themselves healthy and injury-free in 2022, and try to be as specific as possible. I know we talked about the prongs and mental health and food as medicine and nutrition and cross training, but maybe what are the 3 priorities like you want to see happening right now so that we can get a grip on this and make some improvements here?
Yeah. I appreciate the question. You told me what you would ask earlier, so that gave me a chance to put some good thought into
Yeah.
this. And I knew this was an important question, and so I did put some good thought into it. So, number one, learn more about how the body is designed and how it works. So there's the anatomy and movement part of that, right? And movement we call kinesiology. So the anatomy and the movement aspect. But then there's also the physiology part of it. So the nutrition, the exercise recovery, the activity variety, the rest and sleep. And I think rest and sleep is something we don't get enough of as a general rule in Western society. And so, learn about how that body is designed and how it works. That's number one thing that you need to do. Top priority, no doubt about it.
Love it.
Number two, so for teachers, recognize the demands that you place on your students and adjust as necessary.
Okay.
Dancers,
Love that.
this is two. So we have 2A and 2B. So 2B is dancers, recognize the demands on yourself that you receive and adjust as necessary. So we talked about injury risk reduction and proper management of injuries. It's okay to have an injury.
Yeah.
It happens, and we have to make it okay, right? Um, take a dive into some scientific research. Like go on the National Library of Medicine, right? PubMed.gov, PubMed.gov, G-O-V, and just say, I'm going to go learn something new, and just go in there and enter some search terms and put in dance injuries if you want to, and start reading. You'll get these little paragraphs. You don't have to even read the whole article. You'll get these little paragraphs about what the articles are about. They're called abstracts. And just start reading some of that, right? So take a dive into some scientific research as a part of number 2 here. And
Dancepub
then teachers,
did you say .org or .com?
yeah, PubMed.gov,
PubMed.
PubMed, MED,
.gov.
.gov,
Got it.
G-O-V, yep,
Sorry.
PubMed.gov. Take a dive in there, and then teachers teach this to your dancers.
Yeah.
Teach what you learn to your dancers. Teach your dancers about science while you're teaching them about dance. And one of the ways that you're going to make sure that you learn the material is you'll teach it, because if you teach something, you definitely are learning it, right? You can't teach it without learning it. So it helps you learn. All right, so that's number 2. Number 3 is going to be unexpected. It's going to be unexpected for you. You're going to go, oh, okay, that's an interesting one, because it doesn't seem like it has something specifically to do with dance or dance science or dance medicine, but I think it has everything to do. Number 3 is be a vehicle of grace, not just in a studio, but in the community.
Okay.
Turn off rehearsal and competition mode every so often. Let it be okay to make a mistake or to have pain or to have an injury, and then deal with those well. Grace, what is grace? Grace is getting something that you don't deserve, right? And so I think that this is a way you can encourage others, right? Find ways that you can encourage other people. Whether if you're a dancer, encourage the dancers around you. Encourage your teacher. I think teachers would love to have some appreciation every now and then.
Absolutely.
Teachers appreciate your students, right? Vocalize that, but demonstrate that as well in action. Use your studio platform to make your community better, especially in unexpected ways. And so some ideas here, you want to do things that not just blesses the recipients, but teaches a lesson to the dancers. So for example, take your dance company and without all the glitz and the bling, and just go and perform at a nursing home in the
Yeah.
community. Go to the
Where
food.
so many people would go, that's like, I don't have time for this, but make the time, right?
Go to the homeless shelter and dance for them. Right? You don't need all the bling. You don't need the lights. You don't need the stage. Just go and dance for them. Put something together that shows that you believe they have value and
Yeah.
that you're going to spend some time with them. Because let me tell you what's going to happen. It's going to make a huge. You're going to get a name in the community. They're going to go, oh yeah, those are the guys that go and dance at the nursing homes every so often.
Yeah.
But you're going to teach such a lesson to your youngsters who are dancers, because now it's not about the trophies and the medals and the stage and the lights and the costumes. It's not about any of that. It's focusing on everybody else. It's focused on other people, and you're going to make some people smile that haven't smiled in a long time. All right, so it's a real opportunity to be out in the community that way. There are some people there that deserve to be happy, and you got a chance to make them happy.
I love it.
Go and take your dancers down to the food bank and it's like sort cans of food and help find some of these things that have nothing to do with dance, but then have everything to do with dance. Because what are you doing? You're creating a better environment for your dancers
Absolutely.
and for the studio, for the teachers. You're giving them a gift that you could not buy. There's
Yeah.
there's no online shop to get it at. There's no dance store that you can get it at. It's a gift that is going to be absolutely mind-boggling, and I think that ought to be. And that may not. I didn't necessarily put these in any particular order, but that might ought to be one that could jump up to number one, and you do fine,
Yeah.
right?
Yeah.
Now all of a sudden, it's like I remember. So just recently, this happened. I can't remember if this was in Ohio or Pennsylvania or somewhere. So it snowed, right? So in our part of matter of fact, it's snowing today. We've had a bunch of snow, and so it snowed, and so there was so much snow that they decided that they weren't going to have their usual football practice, right? All the training, like the weightlifting and whatnot, that they were going to do for the football team, they weren't going to do that. The coach said, "Go find you a shovel and go find your neighbors that are elderly or that can't get out, and go shovel their driveway or shovel their sidewalk." Right? And that's going to be football practice today. So we're not going to wait. We're not going to lift weights because school's shut because of the snow. You go plow out somebody's driveway, and that's going to be your weight training for today. Right? What a message that sends, and what a gift that is to the community, and what an incredible lesson to those young men to think about somebody besides themselves for a little while.
Yeah.
Just a
Wow.
thought.
I love it. I love how much, thank you for putting so much thought into those. And I think that you are spot on. Dr. Russell's homework, just to recap, is learn more about how the body is designed and how it works, from anatomy and physiology and everything in between, for teachers to recognize the demands you're placing on your students and adjust as necessary. Teach what you've learned to your dancers so you really get it ingrained up there. Dancers recognizing the demands you place on yourselves and the expectations you place on yourselves and adjust accordingly. If you have an injury, it's okay. It's accepting it. It's dealing with it properly. It's not pushing yourself past your limits. And be a vehicle of grace, and not just in the studio, but in the community. Get outside and do something for others. Put your perspective in the right place. So thank you. Casey said, my sister's college dance team does this. Idaho State Bengal Dancers not only trains, competes at NDA, and supports the university demands and teams, but she puts in volunteer hours and study time. Yeah, that's fantastic. Thank you. Thank you all for watching. Dr. Russell, I know it's been an hour. We've got to wrap up, but I cannot say enough how much insight and wisdom you always provide us. And I know your time is so valuable. So thank you so much for doing it, for being here. I'm going to link, Dr. Russell has all of his resources, his contact information, how you can follow him and get a hold of him. And I'm going to link that in our conversation afterwards. I've put in the chat comments on Facebook the link to our STEPS initiative course. It's a free online course. Every module has been curated by experts in every field, from racism to gender equity to sex abuse and prevention, psychology, nutrition, mental health, advanced medicine and science, of course, all the things things Dr. Russell covered today. You can get a launching pad for education, evidence-based resources from this course, and again, completely free. So please take that at your own pace, enjoy, and share it. It's meant to be shared. It's our gift to the dance community. Our friends at YPAD also have a fantastic certification course that you can take with our code 25% off. So I put that in the comments as well. They're keeping kids happy, healthy, safe, and dance. And they have a certification program that every educator should be taking. If you're working with kids, this is how we're all going to work together to do it. But Dr. Russell, thank you again so much for being here. We always appreciate you coming back.
Absolutely my pleasure. It's a
Yeah.
delight to be with you, and I just wish you and all of your colleagues far and wide all the best, and look forward to, happy to hear from anybody that has questions or needs further conversation. But
Yeah,
yeah, it's been
he's a
joy to be
gem.
with you.
He's a gem. Thank you so much. Next week, Melissa will be back, and we're going to talk about what is ableism and how it's impacting our dance studio culture. We're talking with Devin Hill, who's one of our Apollo advocates. We're excited to talk with them next week, Friday, February 4th already. Crazy, at 2 p.m. Eastern. But tonight, Casey and I will be back on TikTok, Instagram, and Facebook live at 7 p.m. Eastern for 1 hour. You get to ask all the questions about Apollo products, about our journey as entrepreneurs, as a startup, and as mompreneurs. We will answer anything as long as it's nice. So put your comments and questions and experiences on Facebook, TikTok, and Instagram tonight at 7 p.m. Eastern. Grab a drink and join us. Until then, we hope you continue your journey beyond the steps. Thank you, everybody. Have a great weekend. Dr. Russell, much appreciated. Thank you so much.
Yeah, my pleasure.